Welcome to this video, which is part of a series of trainings offered by the Midwest Center for School Mental Health. Our series offers guidance for developing and implementing effective school-based mental health systems. My name is Dr. Mark Sander, and I serve as co-director for the Midwest Center. I'll be joined today by the other co-director of the Midwest Center, Dr. Cheryl Holm Hansen. In this training, we will be talking about best practices in engaging youth and parents in school-based mental health systems. Let's start today's presentation by talking about an overarching framework called the Comprehensive School Mental Health Systems. In this framework, which was developed by the National Center for School Mental Health and the Mental Health Technology Transfer Center, consists of 8 best practice modules, and teaming is one of those best practice modules. The goal of Comprehensive School Mental Health Systems is to give districts and schools concrete information on tools so that they can implement best practices and build effective systems to support all students and families. And a critical component of teaming is the involvement of youth and families. We'll talk about that more as we go through today's video. So to start with, what is a school mental health team? It is a group of school and community stakeholders that meet regularly, use data-based decision-making, and rely on action planning to support student mental health. Again, I want to emphasize those 3 critical characteristics again. Meeting regularly, using data-based decision-making, and they rely on action planning. Too often we have districts or school mental health teams that meet infrequently, or they don't use data, or they do both of those, but they don't do a good job of action planning and then following up on the actions that they've taken and to figure out whether those actions and interventions have worked to support the student or family. As I said, within the teaming best practice module, there are teaming quality indicators that lay out critical components to having a strong, effective, and high-functioning school mental health team. And one of those key components is youth and family partnerships and authentic engagement. Throughout the rest of this video, we'll talk about strategies, structures, and supports that you can develop at your school or district school mental health team to ensure that you have these successful partnerships with youth and families. So why is it important to have youth and caregivers engaged in your school mental health team? What we know is that when youth and caregivers are involved in designing, implementing, and giving ongoing feedback on programs and practices, that those programs and practices lead to better health and educational outcomes for students. When youth and caregivers are engaged in school mental health teams, there often is a more comprehensive and well-informed approach to the program design that incorporates culturally relevant practices and policies. Additionally, centering youth and caregiver voice is a key principle of trauma-informed and healing-centered systems. So here's a quote from the Society for Kids Mental Health that I think helps summarize this theme. There is some evidence that family involvement in planning, implementing, and evaluating services may be more critical factor in the effectiveness of services for children and youth than the particular type of intervention provided. So families' involvement in the planning and implementing and evaluating might be a more critical factor in the effectiveness of services than the actual particular type of intervention. So given this evidence, it's not surprising that several national frameworks cite youth and caregiver engagement as a critical component. I'll just name a few of these frameworks. So the SAMHSA System of Care Framework, the National Child and Traumatic Stress Network, the National Center on Safe, Supportive School Environments, and the Comprehensive School Mental Health Systems Framework developed by the National Center for School Mental Health, just to name a few. When we think about engagement, there are really three types of engagement that we talk about most often. The first is engagement at the individual youth or individual family level. The second type of engagement is engagement at the school or program service level. And the third type of engagement is at the system and advocacy level. Our conversation today is going to focus mostly on that second level, which is the school and program service level, but we'll also touch on the system and advocacy level as well. Efforts at the school and program service level typically involve youth and caregivers being engaged in school mental health teams, where they help with needs assessment, resource mapping, program design, program implementation, and evaluation. So let's take a few minutes to define a few terms and concepts. First, what are family-driven services? Family-driven services engage caregivers in assessing their child's or family's needs and view the caregiver as an expert on their child and their family. Family-driven services actively support caregivers in their role as parents and inform caregivers about the process of assessment and treatment, describe and discuss treatment options, and review and discuss possible outcomes so that caregivers can make an informed decision on what will work best for their child and their family. Family-driven services also keep caregivers meaningfully involved and engaged throughout their child's treatment so that the caregiver knows how to support their child during the therapy process. Next, we're going to talk about what we mean by engaging youth and caregivers at the school or program service level. Through school-based mental health teams or other structures, caregivers and youth can participate in quality improvement processes, help evaluate services, serve as co-trainers in education, training, professional development for educators and mental health staff. They can help support staff recruitment and selection, and they can help develop educational resources for families. It is important to have youth and caregivers ongoingly involved in your school mental health team and not just brought in to help with a certain task or function. Without ongoing engagement, youth and caregivers will not have the overall context and vision of your work that your team is trying to accomplish. What could the role of youth and caregivers be at the policy or advocacy level? Your school mental health team could have youth and caregivers actively involved in reviewing and writing policy to help bring that youth and caregiver voice and experience to that policy. They can participate with you on a task force, work groups, or other councils that inform mental health, school mental health, and the education field on issues and trends that they're seeing in their community and their schools. They could help you innovate and improve the quality of your programming by engaging in family-based evidence gathering around best practices. So there's a lot of ways that youth and families can be very instrumental at the policy and advocacy level. In addition, they could help write testimony or perhaps testify themselves. They could also help organize other youth and caregivers around policies and help with advocacy around different issues related to school-based mental health and educational supports for youth and families. So given all these different roles for youth and caregivers, in addition to your school mental health team, so what are other ways to kind of include them? So you could add them to an existing board or team that you already have. You could add them to an ad hoc committee. You could add them to a standing advisory group. You could have them serve in consultant roles or have them be peer educators and peer supports for other youth or caregivers. So there's lots of different roles that youth and caregivers can play in your school mental health system. One suggestion that I would have, if you are new to involving youth and caregivers, is start small. Have them join just one or two groups and start there and make sure that is a very successful experience for the youth and for the families, and that as a school or a district, that you are really doing everything that you need to support them and make sure that you're lifting up their voice. With that, I'm going to transition to Dr. Cheryl Holm Hansen for the next part of this video today.
Mark has just outlined some important information about why and how youth and families could be involved in school mental health efforts. My name is Dr. Cheryl Holm Hansen, and I'm the other co-director for the Midwest Center for School Mental Health. I'm going to talk about some ways to conceptualize the quality or depth of this engagement. In thinking about family participation in the schools, it may be helpful to first consider the difference between involvement and engagement. This difference is summarized in this quote. Involvement of families and services is important, but real engagement goes beyond that. Families can be involved and compliant without being engaged. Engagement is about motivating and empowering families to recognize their own needs, strengths, and resources, and to take an active role in changing things for the better. Engagement is what keeps families working in the long and sometimes slow process of positive change. Based on this definition, we can see involvement as a one-way interaction, where the school approaches the family with a request or an invitation, such as inviting the family to come to an informational meeting. Engagement, in contrast, is a two-way relationship, where the family and the schools come together in a more reciprocal relationship. The National Federation of Families has a long history of promoting family engagement in schools and other settings. They propose that authentic family engagement has three components. First, there should be opportunities for families to build their capabilities and connections. What can they gain by working with you? Are they there to serve only your needs, or are there also opportunities for them to develop skills or make beneficial connections? As you are planning for meetings, can there be ways to build opportunities for parents into your process? Remember that with true engagement, parents should be working with you to co-create these opportunities for growth or learning. While not intentional, over time, professionals who serve families and communities may pick up some bias that leads them to negative assumptions about families that may be struggling with life circumstances or mental health issues. It is true that school staff and mental health providers have specialized training that parents may not share. However, that does not mean they are more knowledgeable or capable than the parents in planning school-based mental health efforts. This leads to the second principle of authentic engagement, which states that families should be seen as capable, competent partners in their children's development and learning, even when they are struggling with significant adversities. The third principle is that family engagement strategies are systematically embedded within and across systems and programs. Family engagement is sometimes developed as a side or a parallel process or as a specific time-limited opportunity. While these strategies may provide useful information for schools or for mental health providers, it is not true engagement. Consider the ways that decisions are made in your organization. Are there opportunities to revise these existing processes to better center family voice? What do you need to do to sustain and to build this engagement over time? In addition to parents, you may be considering opportunities to partner with youth. Hart's Ladder can help you assess the ways in which youth may be engaged in initiatives. Hart's Ladder of Youth Engagement is a commonly used model within youth development and highlights the various ways that youth may be engaged in decision-making within a school or other youth-serving organization. At the bottom of the ladder, we have stages of manipulation, decoration, and tokenism. Manipulation is when adults lead activities and make decisions, and youth are directed only to do as they are told. With decoration, Youth may be showcased as participants, but without having had any input into these activities. Tokenism usually involves youth being consulted, but without actually having meaningful opportunities to influence decisions. In Hart's framework, all three of these levels are defined as a lack of engagement. As we move up the ladder, youth are given greater voice in decision-making, and there's a growing emphasis on the level of partnership between the youth and the adults. At stage 4, youth are given an active role in activities, but don't have any decision-making power. At level 5, the adults are still the ones making the decisions, but youth now have an opportunity to provide input. As we move towards the top of the ladder, we see youth voice becoming stronger. At level 6, youth gain more decision-making power, though adults may still have initiated the activity. Level 7 and 8 apply to situations in which youth are the drivers, initiating and leading their own processes, either independently or with shared decision-making with the adults. As you think about the work that is going on in your school or agency related to youth engagement, where do you think you typically fall on this continuum? Where would your youth think that you fall on this continuum? And are you where you want to be? If not, consider ways to move further up this ladder. Effectively and appropriately engaging parents and youth in teams or work groups can be complicated to do well. If it was easy, we would see this happening more consistently across all schools and mental health agencies. We're going to focus most of our remaining time today on tips and strategies for strengthening engagement. But first, it's helpful to think about the barriers or challenges that need to be addressed in your plan. As you think about your current level of family engagement, what barriers do you face in building deeper and more authentic parent or youth partnership with your school-based mental health planning or implementation teams? Identifying potential barriers and intentionally building in strategies to mitigate them is a necessary step in moving forward. A common starting point is to think about the logistical barriers. It may not be easy for parents or youth to attend meetings that we've scheduled around the convenience of the team. The staff on your team may decide that Tuesdays at 1 p.m. work best for their schedules. It's worth asking whether your parents or youth can attend at this time. Maybe, but it is more likely that this time will pose challenges for youth who are in class, or for parents who are at their own jobs at that time and may not have flexibility to leave for your meeting. There may also be challenges getting to the meeting location. Parents may have other children that they need to be caring for at that time. You need to be open to working with parents or youth to arrange meetings that work for them in addition to the school or agency staff. Identifying meeting times and locations that make it easier for them to participate may be challenging, but it is hard to build authentic engagement with people who are not even able to join your meetings. While the logistical barriers are important, they can often be addressed with some flexibility and creativity. However, there are deeper factors that can get in the way of authentic engagement. When schools or other child-serving organizations are asked why parents and youth are not involved, they often raise a number of concerns. They may have had negative experiences with parents, or worry that parents are just going to complain or focus on their own child or family. They may be concerned about the time or resources needed to support parent or youth involvement. They may even perceive parents or youth as not ready to engage or not interested in engaging. There may be some truth to some of these barriers some of the time. However, what's most interesting is the comparison with what parents identify as the barriers to their engagement. In contrast to the staff, parents and youth tend to highlight the way that they feel or the way that they fear they'll be made to feel in settings where they are collaborating with professionals. Some concerns may be specific to engaging in spaces related to mental health. Youth, for instance, may not want to be identified as having a mental health issue or receiving mental health services. There may be concerns about sharing information in group settings or fear that their personal information won't be kept confidential by the rest of the team. However, the greatest concerns often focus on the interactions between family members and the professionals. As professionals, we often convey implicitly or explicitly an assumption that we know best because of our training and our expertise. Family members may feel overpowered and outnumbered. Families may have had negative experiences with school staff or mental health professionals as a parent or even from when they were students themselves. Staff lack of cultural understanding can also be a huge factor. The relationship challenges that we describe for parents come out for youth as well, with youth often feeling disempowered in adult-oriented spaces. As summarized in this quote, unfortunately, the integration of youth into a decision-making body can prove to be quite challenging. Perhaps the biggest obstacle stems from adults questioning the abilities of youth. We will talk more about this in the recommendation section in a few minutes. But ultimately, the theme that results here is that we can overcome these barriers. However, it takes time, and it takes a deep and sustained commitment to partner authentically.
Now that we took a deep dive into potential barriers to youth and family engagement and some of the strategies to overcome them, let's talk about how you can get started engaging youth and families. One key thing we've found throughout our work is that engagement requires commitment. It requires committing to sustaining ongoing partnerships with youth and families. These partnerships would need to center youth and family voice around all aspects of your project or program, including decision-making. In order to do this, we need to create spaces that honor and support the child-parent relationship that is central to a child's healthy development, school readiness, and well-being. It also requires acknowledging that families are experts and allowing space for them to help us better understand how to support them and their youth. If you're committed to engaging youth and caregivers being a part of your teams and projects, it is important to ask them what they need to feel supported when joining your team. Some of the things that we have heard that would be helpful are: describe to them how the meetings are conducted. Is there a formal structure? Is there an informal structure to how meetings occur? Are they virtual? Are they in person? Are they hybrid? Another thing that we have heard is that it's really important to share past agendas and meeting notes and any other history about the meeting so that they feel up to date and understand previous decisions and feel knowledgeable about the goals and purpose of the group. You might also want to offer to meet with youth and families before the meeting to go over the agenda and discuss any questions that they might have before going into the meeting, and also ask them if there's anything that they would like to add to the agenda. Similarly, you could also offer, in addition to meeting ahead of time, meeting to debrief with the youth and or caregiver. We have found it doesn't always need to happen ongoingly, but it is really good to have some of these debriefing after the first several meetings, just to really create a safe space for them to ask questions that they maybe weren't comfortable asking in the meeting, clarify information, and then this allows them to gain confidence for working with you and your team in a much deeper way. Having youth and families join a team can be a significant shift for your staff. Staff that you work with will most likely need some support to make sure that they are ready to invite and have youth and or caregivers be a part of the team. It's also important that you've got buy-in from your team about the importance of youth and caregiver involvement, including involvement in decision-making. It's also important to talk with your staff around needing to not use professional jargon and acronyms, as this can get in the way of youth and families feeling comfortable in the meetings, as they're not maybe understanding some of the information, and therefore they're not sharing their voice as much. So a couple of questions that we found that can be helpful engaging the readiness of your team to think about bringing youth and caregivers on your team. Some of the things that we think are important around readiness are, do you have flexibility in your upcoming implementation or work plans that they could be involved in? Are there spaces where youth or caregiver voice will clarify your direction? Right? You're really needing their input right now. Another important question is, are you willing or able to adjust the meeting times and or locations to accommodate parents and youth to have their involvement? Are you willing to change the ways that the meetings are facilitated to encourage parent and youth participation? Do you have the resources to support parents and youth being able to meaningfully engage? For example, do you have a staff person who could work closely with them to answer questions and provide ongoing support? Another question is, do you have funds to help for transportation, child care need, or to give them a stipend for participating in the group? Another critical question is, do you understand the cultural community served by your school? This can be really important in determining who you might want to recruit to be part of your school mental health team. So again, these are just some ideas that we have heard from the literature and also from our experience that can really make having youth engagement and family engagement be successful. So hopefully this will help you move forward into creating an environment for authentic communication, collaboration, and engagement for your team and youth and families. Now we want to transition back to Cheryl, who will be closing out the rest of the presentation today. Thanks so much.
In the last section of this video, we'll outline some recommendations for integrating parents and youth into teams. First, let's consider some strategies for recruiting parents or youth to participate in your school teams. Recruitment is not a one-time effort and should be done on an ongoing basis. Even if you feel like you have a strong group of current participants, you should be continuously seeking out new family members who might be involved in current or future work. This ongoing effort helps prepare you for potential expansion in your teams, while also planning for succession by cultivating leadership among your pool of interested family members. It's best to use multiple strategies when recruiting family members. There are a number of different options that you can consider. You can certainly conduct outreach to families directly, offering opportunities to get involved through newsletters or other communications. However, more targeted and intentional strategies are typically needed. You can ask staff for recommendations of parents to reach out to personally. This could include school staff or community organizations that you partner with or are familiar with. They may know parents who have expressed interest in getting more deeply involved. If your community has any existing family advocacy or navigation programs, that's also a great place to start. They can often help connect you with family members that are looking for ways to be more engaged in policy or practice decision-making. If you have events or meetings for families, you can recruit there as well. It's especially helpful if other family members or youth who are already engaged in your work can help participate in this outreach to other parents or youth. When recruiting family members, provide clear information about roles and responsibilities. Be specific about your ask. What do you anticipate engagement looking like? What is the role of the team? What are they trying to accomplish? What kind of meeting schedule has been established? Are there also expectations that work will be done between meetings? If so, what does that look like? What is the role of family members in the team? When you have found family members to participate, you need to actively and intentionally support their participation. As mentioned earlier, this may require some flexibility related to meeting times and locations. You may need to schedule meetings around parent availability or provide flexible options for attending, such as allowing people to join the meeting virtually. Consider holding meetings in non-school community locations. Other locations may be more convenient for family members or may be more comfortable for families that have had negative experiences with the schools in the past. You may also need to provide translators to support families in participating fully in the meeting. It is strongly encouraged that you build in some funding to support family participation. The professionals participating in your process are typically being paid to attend meetings, while we often expect youth or parents to volunteer their time. Offering a stipend to family members can help promote equity across the team. It can also be helpful to reduce the financial barriers that families may face in attending, such as covering the costs of their transportation or childcare. It can be difficult for family members to join an existing team or committee, which already has established relationships and a team culture. It's best if you can have multiple students or families on the team, including having a few people start at the same time if possible. It helps to not feel like you are the outsider on the group and to have a start in building connections with others. It's also a critical strategy in ensuring that families are not tokenized, with one youth or parent expected to represent the diverse array of all family stakeholders who are influenced or impacted by the work of the team. Especially at first, family members may need some additional support in orienting to the work of the team. If the work has been ongoing for some time, it may be difficult for newcomers to understand the context of the work that is being done or the decisions that have been made. As professionals, it's also easy for us to over-rely on jargon or acronyms that may not be well known by others. It may be helpful to add some additional processes to ensure that family members have this added context and are ready to fully participate. You may want to provide some guidance or foundational information prior to each meeting to provide parents with an opportunity to become familiarized with the content of what's going to be discussed and what decisions will be made. After the meeting, follow up with them to check in. It can be helpful to provide clarification about the meeting discussion and to receive feedback from the family members regarding how they experienced the meeting. These strategies can be helpful, but are still based on the assumption that you are inviting families into an existing meeting process that was developed by and for the professionals. You may need to reflect on your meeting process and revise your approach to be more accessible and inclusive for all of your participants. I especially like some of the recommendations included in the Harvard University Inclusive Meeting Guide. Consider these tips as you are planning your engagement work. First, proactively consider how diversity and power dynamics affect attendee engagement. Pay attention to who is participating and how they are participating. Make sure all attendees understand their role in promoting an inclusive and respectful environment. Set standards about professional conduct and gender-inclusive, appropriate language. Create shared expectations regarding engagement during meetings, including the use of video and chat features during virtual meetings. For example, you may agree to things like not interrupting each other, honoring confidentiality by not sharing details about what happens in the meeting, and intentionally soliciting alternate perspectives when making decisions. At the beginning of each meeting, check in to see how people are doing and allow some time to build relationships and connections with each other. Ensure that all attendees speak one at a time. If someone is interrupted, step in quickly. You can model behaviors like asking people to go back to what they were saying before you move on to a new topic, or making sure that you understand people's points, even if they were cut off in the conversation. Look out for conversation dominators. If someone is controlling the dialogue, redirect the conversation back to the broader group. Amplify the voices of others by acknowledging their contributions and giving public attribution to their ideas. Be mindful of conformity bias, which occurs when people feel pressured to agree with everyone else in the room. Consider intentionally asking the group to generate different viewpoints. Allow attendees to contribute in the ways that they feel most comfortable. Not all meeting attendees may be equally comfortable speaking up during a meeting, especially if they have a viewpoint or experience that may be different from what is being shared. Provide alternate ways to share ideas, such as allowing people to add thoughts to a chat box during virtual meetings, or pausing and giving each person at the meeting an opportunity to share a perspective before you make a decision. Allow time for people to think and reflect. Some attendees may not be comfortable sharing their ideas right away. It may be helpful, for instance, to have a preliminary discussion about an issue at one meeting, but to defer any decision-making until the following meeting to give people time to pause and reflect. To avoid getting off topic, suggest that alternate ideas be written down and placed in a virtual parking lot to be discussed at the end of the meeting if you have time. This can help attendees who have trouble focusing and also avoid conversation dominators. It also helps to keep you on track if there is a specific decision or endpoint that you need to reach during that meeting. Reiterate the group's consensus and provide opportunities for people to voice agreement or concerns. This can help ensure that everyone has the opportunity to speak and to be heard before you begin implementing decisions. As a final recommendation, it's important to evaluate your family engagement. This can happen formally, such as using existing feedback surveys or other processes. It may also involve informal opportunities to ask all attendees their thoughts about how the meetings or other processes are going, and to ask if they have any suggestions. Consider asking questions such as, what went well? What could be better next time? What could I practice or model at the next meeting? What do I need to learn more about? Use feedback that you receive to improve the way you are organizing meetings and expanding on your family engagement efforts. Use this feedback as part of a continuous quality improvement process to continuously enhance the quality of the meetings and the depth of your engagement and partnership with families. We hope that this information has been a helpful starting point. Please visit our website at the Midwest Center for School Mental Health for additional resources. Thanks and have a great day.